So today we are going to learn once again for those who had already attended my previous lecture series. And for some new students, this is new insight. While learning in the second year of our BHMS syllabus, we have learned these aphorisms from 83 to 105. It's about case taking. And Dr. Hahnemann has clearly given instructions about how to take the case. But here, I want to give you some insights because the understanding of this aphorism is very much necessary for every person who is going to practice homeopathy. As this edition, the sixth edition, was translated in 1921, almost 100 years back. So now it is necessary for us to understand these aphorisms in detail in today's language. So I am trying to convey the meaning what Hahnemann had to say at that time and now how it is applicable practically in today's era. So let's start. There are two main things required as it is given in aphorism number 3, the knowledge of physician, the knowledge of diseases and the knowledge of medicine. And further things are little less important. I don't say they are not important, but these two things should be understood in detail, knowledge of disease and knowledge of medicine. When we will learn different medicines from materia medica and from different cases, then only we can have knowledge of medicine. But when patient will come to us and will take the case, then only we will have knowledge of disease. So knowledge of disease is the first thing that we should understand, the way of case taking in detail. Then we can understand what problem our patients are having. And then we can solve those problems with our knowledge of medicines. So knowledge of disease and knowledge of medicine, these two primary things required for any physician to practice homeopathy. Now it's a confusion for many beginners that there are different methods and systems available for any homeopath to practice. And when students pass out from any medical college and they go out, they get confused because there is sensation method, there is predictive method, mind method, Sehgal method, Kolkata method is there, virgin homeopathy is there, HHF is there, and every method has something to offer to any beginner homeopath. And people get confused, students get confused, and they go to any method and then they go to another, then to another. They keep trying from one method to another method. I must tell you here that none of this method is wrong. But every method has its own advantages and some limitations. So if we understand the basic things first, and then we apply any of this method, that will be more helpful for us. Before confirming and making our basics clear, if you jump to any, just like before graduation, if you go for post-graduation, that will be difficult. Similarly, first basic understanding of homeopathy is important, and then you can go to any method and you will be a successful homeopath. So don't feel confused among different methods. If you need, I will tell you what are pros and cons of each method in some other time. Let's go with the aphorism 83. In the very first line, Dr. Hahnemann has mentioned the definition of case taking. It is an individualizing examination of a case of patient, a case of disease. So it's an examination, but it is not only physical examination or clinical examination. We go in details of the history of that disease and we try to get some characteristic symptoms out of it. And when these characteristic symptoms, we call them as PQRS symptoms. These PQRS symptoms make the case unique. So that is the process of individualization. Individualization is nothing different. We try to find out what is characteristic in the case. And the list of those characteristic symptoms will indicate us the right remedy. Here, Dr. Hahnemann has mentioned that there are 4 requisites which every physician should have. Very first thing is unprejudiced mind. In book, it is written freedom from prejudice. I think that is more appropriate word, that every one of us is prejudiced. What makes us prejudiced? Our knowledge makes us prejudiced. But we cannot remove that information from our brain, from our memory. So being a knowledgeous means being a prejudice. But still we can get freedom from that prejudiceness. How? It is so simple. Just tell yourself that I know but. A patient comes to you and tells you, doctor, I have viral fever, please give me medicine. And you must be knowing some medicines for viral fever. Or patient says, doctor, I have migraine, please give some medicine. So you know there are many remedies for migraine. So which one you will select? Someone will say nitramur, someone will say glonine, someone will say belladonna. Don't do like this. You just say, I know these are the remedies, but I have to see the details of the case. I have to find out characteristic symptoms of the case, and then I can select one remedy which will be most appropriate for this case. In this way, you can get freedom from your prejudice ideas which has developed because you have studied remedies well. In this way, once you become prejudiced, then the second point required for physician is sound senses. Because you are just talking and asking question is not enough. When patient is sitting in front of you and telling his complaints, you should observe the patient carefully. So your eyes, your smell, hearing, and touch, these 4 senses should be alert. So when you will examine, from touch you can understand something. When you are listening to the patient, at the same time you are observing. Even when you go near to the patient, if you get any smell, that you have to note down. So your senses should be sound enough and alert enough. Even though they are sound, but you have not observed any act of the patient, then it is not useful. So your senses should be alert also. And if you keep these senses alert, then you can solve your cases, even difficult cases, with ease. So the third requisite is attention in observing. Your complete focus should be on observing the patient. You may say that patient is telling the complaint, so I have to write down. So I will listen and I will write. Definitely, you have to write down the important part of the patient's narration. Not exactly word to word, but important part. But along with that, there are many observations of patient which will be helpful for us in the final selection of remedy. Because after repertorization, we get 4, 5 or 6 remedies covering almost all the symptoms that we have given to repertory. And at that time, our observation will help us to differentiate among different remedies. So attention in observing is equally important. And the last one is fidelity in tracing the picture of disease. Whatever process you are going to perform in front of the patient, that process of case taking you should trust in. If you trust, your patient will trust. If you do not trust, your patient will also do not trust in you. So there has to be trust that the way in which I will take the case, it will lead me to the semilimum of this patient. If you have this confidence, then only it will work for your patient. So be confident. If you have a knowledge, then there has to be confidence. If you don't have proper knowledge, then get it. And that knowledge will give you confidence, and then fidelity will come. So sometimes there can be some challenging cases, some difficult cases. At that time, I prefer to tell my students that you should prepare yourself to listen. If you have any work before case, just keep aside and try to study. If you have a phone call before the patient's appointment and your patient is coming for interview by appointment, then you know that what kind of disease patient is suffering from. So make preparation and be ready to listen to the patient. And to get calm for your work, you can do meditation, say for 5 to 10 minutes before starting the case. That helps us a lot so that we become blank from our personal thoughts. And then in that blank state, we can listen unprejudicedly to the patient. How to start the case? There are different ways. Sometimes patients come by taking appointment. If you are a very beginner homeopath, then patients come even without appointment also. In both the situations, you should be ready to take the case. If patient comes by appointment, you can say you will get prepared for that. If you ask me what I do, I share one PDF file in which there are some questions and patient has to write or type the answers of those questions and send to me so that some preliminary data is available in front of me before I go for interview. And on the basis of that data, I prepare my questions and only those questions I ask in the interview so that the time required for the case taking get reduced and you get more data. This is one of the advantage of giving questionnaire before from physician side, and from patient side also there is advantage. Advantage is patient writes down all the complaints with his own comfortable time and in which he may remember many other things, which he cannot remember at a time when he is in front of the physician. So it is better for us if we get the patient by appointment. But if patient doesn't come by appointment, it's okay. You should be, if you are in the clinic, you should be ready to take the case. So when patient enters, some patients start talking. These are talkative patients. So for those patients, you have to just write down. You don't have to ask questions. You don't have to make initial formalities and all. Not necessary. Don't go for it. And then at the end of the case, you will get enough number of symptoms. And such patients will get cured easily because they have given more symptoms and enough data for processing. But there are another type of patients who do not talk at all. They will just tell you, doctor, I have pain in stomach. So do whatever you want to. These are the patients, you can say, indolent type of patients. For such patients, you need to work more, work hard. You have to ask many questions, and to every question they will answer in single sentence or one or two sentences. So here you have to work hard. You have to go in details of everything, and some leading questions also you need to ask. Not in initial phase, but in the final phase of the case taking. How to ask those questions, that also we will discuss. I have put this slide, which is not about case taking, but it is about how to respond to any person who has undergone abuse. And there are some guidelines for the counselor how to approach to such person. And I feel these guidelines are as per the Hahnemannian guidelines, at least first 4 guidelines. And so I want to show you that. The very first point is listen. Just I told you now that when patient enters in your cabin, he starts talking. So if patient is talking about the complaints, start writing down the complaints. Some student ask me, sir, when to ask the preliminary data and all. Sir, preliminary data is name and age and address and phone number. That patient never forgets. That you can ask at the end of the case. No problem. But what patient may forget is his symptom. So he should not forget. So when he is in mood to talk about those complaints, let's listen the first. So the first point is listen. See the second point, do not interrupt. In our guidelines also, Hahnemann has given the same thing. Do not interrupt the thought process of the patient. Once you interrupt, that same thought process may not come in the same sequence again. So it is very, very important just to listening passively and writing down the important part of the case. Then the third point is pause. This pause is very, very important for physician point of view and patient point of view also. When patient is not talking, we feel that now patient has finished his complaint. So now it is our turn to ask the question. So we are in a hurry to ask question. But I must tell you that when patient stops, just look at the patient and from his face try to understand whether he is reminding something, he is in conditioned to tell you something, then just give the pause. Do not ask your questions. Just make your questions ready. If you want to remind your questions, put it written on your paper and just look at the patient and be silent. Because when patient takes a pause, he must be reminding something. He may tell you some more important thing and you don't have to interrupt that thought process. So pause is a silence, but that is very, very important. And I tell you from my experience, because of this pause, many important things have come out. And next is, do not ask too many questions at first. If you ask too many questions, patient will start answering in very short format. So our question should be broad. Our question should be small. And our questions should be compelling the patient to talk more. So simple thing, what are your problems? What are your problems? So here we assume that patient has many problems, more than one problem. So patient will go on telling. Otherwise, nowadays, there are many specialists in modern medicine and patients go there and they complain about only one system of the body or one organ of the body. And now they are habituated to do that. So when someone tells you that you are a doctor for migraine, they will come to you and they will tell you for headache only. And they will not tell you anything about back pain. So in the initial phase, if you get a chance, you have to tell your patient that please tell me all of your complaints, and for all those complaints, I will tell you one medicine.
Hello guys. So how was this video for you? Please comment and tell us. Don't forget to like and subscribe our channel for similar videos in future. If you have any questions, please feel free to ask in comments. We will definitely answer each and every question asked by you. If you have any need of homeopathic treatment, we offer classical homeopathic treatment and counseling for different mental health problems. Please feel free to WhatsApp us or visit our website. Please follow us on Instagram and Facebook as well. Thank you very much.